I'm Dr. Anita Rao, and today I would like to talk to you about lumbar epidural steroid injections. Low back pain is the most common reason that patients present to their primary care physicians, and it's a common condition that we see in clinical practice. There are a variety of options that patients have, and by the time that they come to see me in the office, they've probably already had a combination of medications and/or physical therapy. When we're looking for non-surgical options for patients, epidural steroid injections offer an alternative for patients to have for treatment of their pain. Patients that come into the office oftentimes will complain of pain in their back, pain down into their buttocks, or down even into their lower extremities. There are a variety of different ways to approach this problem. The most common way that we hear about epidural injections is actually not an epidural steroid injection at all. It's for women who are in labor. Epidurals can provide pain relief and have for quite some time for women that are in labor. But an epidural steroid injection is something entirely different. Although the placement of the needle goes into what is called the epidural space. The epidural space is the area in which the nerves live. The medication that we put in for an epidural steroid injection is different than when women are in labor. And essentially what we're doing is we're delivering steroid to this area, and I'll describe it in essentially three different ways. One is called an interlaminar approach. And basically what we do is we place medication through a small needle under X-ray guidance into the spinal canal. This medication bathes the nerve roots with steroid. Steroid is an anti-inflammatory. It's intended to get the inflammation down because most commonly inflammation of the nerves is what causes pain. This is a very straightforward procedure. We do it typically in the office under local anesthetic. What that means is that we provide a numbing agent to the area of the skin and the soft tissues on the outside of the spine before placing the needle into the spinal canal. The needle is placed under X-ray guidance. We deliver a small amount of steroid, and the procedure takes less than 5 minutes. The interlaminar approach means that we're placing medication centrally, not off to the sides. There's an alternative to this called a transforaminal injection. And what that refers to is placing medication from the side. And this is a highly effective technique for patients that come in and present with pain in one or both legs. It's an alternative to delivering the medication to the interlaminar approach. And essentially, everything else is the same. We use local anesthetic. We place the needle under X-ray guidance into the spinal canal from a side approach. We deliver steroid in a very similar manner. The medication essentially is the same as the interlaminar approach. And depending on the patient's condition, we determine which injection would be more appropriate for you. Another alternative to these procedures is called a caudal injection. And when described, this injection sounds more invasive, and really it isn't. A caudal injection is just a different way to deliver the medication into the spinal canal. Instead of putting medication into one of the areas of the lumbar spine, we come down a little bit lower. There's an area at the distal part of your tailbone called the caudal epidural space. And again, using local anesthetic, we place a small needle under X-ray guidance. The advantage of this technique over the others is that we can also pass a catheter into the spinal canal up into the areas where the patient or you may have significant pain. This is also an alternative that we have for patients that have had prior spine surgery. This avoids scar tissue and other elements that may interfere with successful delivery of the steroid. Essentially, although it sounds more invasive, this technique is a very common technique and has been used for a very long time for treatment of chronic pain. This technique delivers the same type of steroid that we described for the interlaminar or for the transforaminal approach. It's just a different way to give the medication a chance to work. I'm Dr. Anita Rao, and if you would like to make an appointment with me, please contact me at the number below.